There are many issues in gender-based violence. We know one is the medical part, but more so there are the other issues of forensic, where we lose a lot. How to collect data, how to pass over the data to the national, to preservation of forensic evidence, and how to pass on the information so that people can actually be prosecuted and justice for the survivors is actually achieved.
When the investigating officer visits crime scene, he's supposed to collect all evidence, and we have bags, paper bags, which are designed for evidence protection, depending on the evidence. Is it liquid? Is it cloth? Is it dry? So we have different kind of bags that are designed purposely for that. And once he takes them, he's supposed to preserve them as per the regulations for the investigation. Once the exhibit is collected and put in that bag, the investigating officer or the scene of crime officer, because they work together, they're supposed to seal it there and there to avoid anything else getting in there to contaminate the exhibit.
But in instances where we are talking about rape of an adult woman, it can be very difficult if there is no medical evidence to corroborate, simply because it was tampered with at the scene of crime.
Someone who is defiled sexually or raped, there's a rule in forensic which says that when two bodies undergo a violent encounter, there's usually exchange of materials, especially the DNA materials, and this is where the forensic become important for extraction of DNA material. There are also some trace elements. For example, hair, hair from the victim, hair from the assailant, which can get in those areas, and they are very important for collection because of for the purpose of evidence. Some people also bite the victim, some people roughly kiss the victim, all of that. So we need also swabs from the mouth, swab from the bite marks. At times you may find matted hair. Matted hair is whereby probably this assailant secretion remain on the hair, and you see when this secretion remain on the hair, they'll be matted together. So this need to be shaved very well and taken to the crime clinic for further analysis. Other things include blood, because many times there can be a fight. This can fight, and the assailant can leave his blood on this victim's clothing and all that. So that's why in a nutshell, forensic, careful actual forensic collection of evidence is very important to be able to tie the case together and be able to get victims.
Evidence collection. Before embarking on a detailed examination of the genital anal area, explain to the survivor each step you will take and specific areas that you will need to inspect. While inspecting, look out for injury on the vaginal walls, including abrasions, lacerations, and bruising. At every stage, collect and trace evidence for foreign bodies and any hairs found.
It may be an uncomfortable procedure, but it is usually short and does not cause too much pain, although it may be uncomfortable. So after explaining to the patient, you need to position them in a way such that there is good exposure of the region that you are going to examine and take the swabs from. So the best position is usually putting the patient in a left lateral position, and they face away from you, and you extend the left lower limb, and then you flex the knee and the hip of the right lower limb. That gives you a good perianal exposure. Again, you expose your patient adequately so that you don't miss any traces. So again, all examinations begin with an inspection. So the perianal region, sometimes you can see bruises within the perianal region. So those are things that you document. So now we are going to demonstrate how you take perineal swabs, that is both vaginal and anal swabs, on rape survivors or sexual violence survivors. And as always, in the first step, it's usually to explain to your patient what you want to do on them. You explain the procedure. If it may cause some pain, you explain that it may be uncomfortable. If then you ask the most convenient position in which they would be. If there are places with pain, you make sure that you don't apply any pressures on those points. So after explaining that, when you're doing your perineal swabs, you explained that you have to expose them. The minimal is from mid-thigh up to the umbilicus. That is the basic minimum exposure for patients whom you want to examine their perineums. So after getting consent and they agree on the procedure or the examination, then you put on your gloves, and after putting on gloves, now we are going to expose the patient as I explained earlier. So we start with the examination of the genitals, and the things that you may be able to see when you look at the genitals from a distance is that you can be able to see some stains of semen. You can be able to see some blood stains. You can be able to see some foreign hair if they are shaved, and sometimes they are actively bleeding. So just from a distance that you can be able to see. Then after that is that you want to separate the labias. And when you separate the labias, again you'll inspect for the presence or absence of the hymen, whether it is torn. You also want to see whether there are any bruises around the introitus. Then, after you have seen whether the hymen is intact or not, whether there are any bruises which could be consistent with attempted but unsuccessful penetration, then now you decide on what kind of swabs you are going to take. Because if it is broken and that's consistent with penetration, then if there are any specimens that you want to take, most likely the semen is shed near the posterior fornix. But if it was unsuccessful, then you just want to take it around the introitus. You don't go very deep. So now I'll demonstrate how you put in the speculum. And before you put in the speculum, we need to position this patient. And the best way to position this patient is to flex both the knee and the hip, and then you abduct. That gives you a good visual field so that you can be able to insert the speculum with minimal discomfort. When we are doing this, we don't swab the vaginal regions because that can contaminate the evidence. So the only thing that you can use is that you can use normal saline to just apply on the speculum so that it is not traumatic as it goes in. So we'll lubricate this with normal saline so that we don't contaminate the evidence. So you insert it in that position. Then once it has gone in, you rotate it into our horizontal axis, and then you spread it. This gives you a good view of the cervix, the posterior fornix. If there are any tears, if there is any pooling of semen in the posterior fornix, and as you come out, you are able to see if there are any tears or bruises within the vaginal wall. So when the speculum is still in situ, then I take a high vaginal swab from the posterior fornix. So again, before you use this swab, you confirm that the seal is not broken and it is intact. So I break the seal and then take a deep vaginal swab, and then you rotate it to get any specimen that would be at the posterior fornix or high up in the vagina. It's a wet preparation for microscopy, so it is usually taken to the lab immediately. It does not need any drying. So once you have gotten your swab, now you need to come out as you inspect the vaginal walls. So you rotate this sideways as you come out, inspecting the integrity of the vaginal wall. And this is for bruises, for tears, and in case the patient needs any other management like stitching. That is usually what this one, the vaginal swab, entails. So all infectious material, you discard it in the rightful bin. And that completes the procedure. You seal your specimen. After sealing the specimen, we are going to write the names, the particulars on the envelope, and then it is taken to the laboratory for examination.
Key information during evidence collection. The role of forensic evidence in criminal investigation is to link or delink the suspect to the crime, ascertain that a sexual offense did actually take place, help in collection of data on perpetrators and suspects of sexual offenses. A scene can either be a person, a place, or an object. Evidence is used to help confirm that there has been sexual contact in the recent past, to help identify the suspect, support the information given by the sexual offences survivor, and also to show that force may have been used. Ensure that specimens are not contaminated by other materials. Store each exhibit separately. Wear gloves at all times for your own protection and to ensure that the exhibit is not contaminated. Biological evidence materials such as body fluids, soiled clothes should be packaged in non-polythene bags. All exhibits, including documents, field e.g. PRC or P3, must be secured in places that guarantee safety and confidentiality.
There are three issues that come up, especially on forensic type of evidence. Is one, it will be used during the trials. One, to link the perpetrator to the survivor, exonerate the wrongfully accused persons, and also link maybe one crime scene to another in a situation whereby the perpetrator has not been arrested. And you know very well that most of these gender-based violence, some of them take place at night. And you'll find maybe the eyewitness testimony may not be very accurate. So the investigating officer will really capitalize on the physical evidence that it's left on the perpetrator or left at the crime scene. So it's very, very important that this evidential material is handled properly. Storage is quite a parameter that needs to be considered, and also the chain of custody of evidence.